Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know that I am MD in Ayurvedic medicine, that is Kaya Chikitsa, and MD in Ayurvedic physiology, that is the Kriya Sharir. So for paid online consultation, you can definitely WhatsApp me on 9226810 My dear friends, we have started the serial Ayurveda in GP, Ayurveda in general medical practice, and today's topic is dental problems, dentistry in general medical practice, some important problems, causes, investigations, and Ayurvedic treatment. So let us talk about dental problems. In this particular discussion, we are going to make Ayurvedic management of the dental problems. Okay. But if you give this particular treatment, if there is not satisfactory improvement, then general practitioner's duty is to refer to the specialist, that is dental surgeon. Okay, that is our duty. Like even Charak has mentioned, or Tatra Dhanvantaryanam Adhikaraha. Whenever surgical things are there, one has to refer to the Sushrut. Similarly, over here, if the dental problems cannot be managed in the general medical practice, then you have to refer the patient to the dental surgeon. Okay. Before that, dental health and dental problems. Some few basic instructions for any disease. Proper chewing of all types of food is very, very essential. Because of our fast lifestyle and fast food, we are getting fast degeneration of each and every body cell. Even our enamel is losing. And then you see the advertisement of Sensodyne toothpaste. Similarly, everything we are not caring that much, and that's why there are a lot of problems. So proper chewing is very much essential. Not only engulfing, because we have the action of grinding over there, biting the complex molecules, salivary secretion, salivary amylase. Everything is starting from the mouth itself. Okay. Otherwise, the God has not made this particular oral cavity. That directly you can start with the esophagus or the trachea. That is not the thing. Okay. Keep away from the very sweet substances like chocolates, cakes, soft meats, and the candies. Because what is happening after eating the sweet, we do not take the proper care immediately after eating. For example, personally, I will also tell very frankly, very rarely the doctor himself admit his mistakes. But I am not that type of person. I am a transparent person. Previously, I used to have the habit of taking some sweet biscuits with the tea, always. And then after some days, I brush every time, I gargle, but then I could not find why there was a cavity in my teeth. And when I visited to my doctor, dental surgeon, he said, "Doctor, it was very in early days of my life, in the young age or in the childhood. Doctor says that eating sweet is not a bad thing, but eating sweet and not cleaning that afterwards, it's a improper thing. And many times we go to the offices, we go to the schools, and after eating the chocolates or the biscuits, sweet biscuits, cream biscuits, we are not able to mouth wash or take the mouthwash or brushing. And that is why you should not take the sweet things. Otherwise, if you are quite confident that once in a while I eat the chocolate and then I clean my teeth immediately, then there will not be problem. Otherwise, that very small particles, molecules, they stuck up to your enamel, and after that they start little bit borrowing of that enamel or the pulp, and then they create the first tartar and then the cavity, etc. So better way, you should avoid the sweets as much as possible, or if you eat, then proper brushing, cleaning. Even you can just make your fingers also. It's not necessary to all the time brushing, because many times wrong brushing also makes the problem. Remember my words. Brushing should be like up and down, up and down, up and down. But many people like hard brushing they do, and that also problems the loosening of the enamel and all these things. Okay. Gargle each time after eating and then brush the teeth, sometimes with the fingers also. Dental checkup once in a year by the dentist, that is also a very good habit. Then because you see that dental treatment are really, really very costly. So for the dental problems, I will suggest my honest that prevention is always better than cure. Once you start the tartar, that is also okay. But once it get cavity, that's a bigger problem. But then infection goes to the root of the teeth, that is the biggest problem. Then you have to do the root canal. Sometimes you lose the teeth, then you have to put the caps, then silver cap and this and that and that. Now there are artificial transplant of the teeth also. But for one tooth, remember my word, implant, for one tooth, 35,000 you have to pay to the dental surgeon. 35, that is of course the permanent tooth, but one tooth. So imagine for you have to 32 teeth. So 35,000 multiplied by 32. And you know that also for the dental problem, none of the medical insurance company pay for the dental problems. That's the worst thing. That's the worst thing. So better way for the dental things, you have to be very, very, very cautious. Okay. Teething problem in the infants, keep the child away from the unhygienic conditions. Then trim the nails at proper intervals. Apply the powder of DK Mali to the gums. This is a very bitter interest, and that reduces the irritation of the gums, and also the what you can say, this is also useful to strong your gums. Okay. Then give the powder of Ativish 15 milligram 2 times a day with the honey, or give the powder of Chopuchini 15 milligram twice a day to make the bones or the teeth more strong in the infants. Next, hypertrophic gums. Gentle massage with gum with the Kailasa Jivana or Shatadauta Gruta, but a better way, avoid the Shatadauta Gruta is better for. But if you apply, immediately spit it out. It should not be engulfed in the body because that is dangerous. It is a rather external application. Okay. So Kailash Jivan is a better, I can suggest you. Then Triphala Gudgulu, 2 tablets 3 times in a day, reduce the infection and the pain. And Swamala compound like Chavanprash from Dhutapapeshwar company, vitamin C is in a very good amount, and 2 teaspoons 3 times in a day with milk, because gum is basically depend on the quality of the micronutrients like vitamin C. Regimen, vitamin C rich foods like lemon, lime, amla should be taken frequently with your food, that is to prevent the hypertrophy of the gums. Next is a pyorrhea, gentle massage the gums with G32. These are the breakable tablets from Allercine company. G32 is the name of the breakable. You can make a powder of it. Just very brittle, fragile powder tablet is that. Then you have to apply that G32 powder on your gums to remove the infection. Then you can also use afterwards Bakula Danta Dhavan, Ayurveda Arkashala, or Irimedadi Tail local application. Then internally, Ayurvedic antibiotic, Sukshma Triphala, Ayurveda Rasashala, Pune, Maharashtra State, 2 tablets 3 times in a day. Sir, what you are saying, Ayurveda Rasashala, Pune? Because I am mentioning, my dear friend, the company and where it is exist. So Pune, Maharashtra State, that's what. Gandhak Rasayan, I always mentioned in the previous videos, Sukshma Triphala and Gandhak Rasayan. I treat it as a broad spectrum Ayurvedic antibiotic. You try it at least few for the patient, and then you will understand that you can prevent the use of modern antibiotics. Of course, it's not all the time, but many times for the mild infection, moderate infection, you can use the Sukshma Triphala and Gandhak Rasayan. Then Triphala Gugulu, 2 tablets 3 times in a day. Then gum toner powder 2 times a day you have to apply. Then for the toothache, whenever there is a pain, local application of Irimedadi oil or Lavand oil, that is a clove oil. Okay. Then Vata Vidvams, Ayurvedic analgesic, 1 to 2 tablets 3 times in a day. Sukshma Triphala, Ayurvedic antibiotic, 2 tablets 3 times in a day. Then Khurasani Ova tranquilizer, 50 milligram 3 times in a day. Then hypersensitive teeth, gargle with the warm sesame oil every day. In spite of spending a lot of things in a different toothpaste and all these things, simple Ayurvedic treatment. Don't forget it. You make a warm sesame oil and put it in the mouth. That should be in an amount that you can move it. Like, I am gargling sesame warm oil. 5 minutes you have to do it and then spit it out. That sesame oil should be thrown out of your mouth. That is very good to protect your enamel and to make it more strong teeth. So this is for hypersensitive teeth. Then halitosis, bad smell to your mouth is more of the times because of the 2 things. One is the any septic focus in the upper part of your body, or there is a problem in your teeth. Okay. So inflammation in sinuses can cause halitosis, that is a bad smell. To when the another your friend will come to near you, he will try to avoid you. Why? Because you are exploiting your bad smell from your mouth. That is called as a halitosis. It is not only with the dental problem, it can be with the another problems. Like for example, sinus problem may be there, chronic pharyngitis, chronic laryngitis, oral causes, bad oral hygiene, tongue will be bad, tongue scraper you are not using, pocket formation in the gums, pyorrhea, and cavities in the teeth due to the food debris. Rarely, pulmonary tuberculosis can also give halitosis. So remember this rare most possibility. Treatment according to the cause, rule out the cause and treat accordingly. Then chewing khadiradivati or eladivati or karpuradivati as a lozenge, just 2 times in a day as a symptomatic treatment. Regular cleaning of the teeth by dentist. Stay away from too much of sweat. Okay, that means pitta prakopak ahar vihar, it should be avoided, because moreover this durgandhi, house smell, is common with the pitta dominant prakriti. So you have to follow the pitta shamak ahar and vihar food and lifestyle. Now periodontal swelling, okay, around the teeth root, periodontal swelling. Infections like the acute or chronic periodontal or the gum abscess. Treatment G32 Allercine company powder is available. Gentle massage. It can easily break. Gentle massage with water. You have to make a paste and apply it. Trifalaguggulu, 2 tablets 3 times in a day. NSAIDs of Ayurveda. Non-steroidal anti-inflammatory drug Trifalaguggulu. Sukshma Trifala and Gandhak Rasayan Ayurvedic antibiotics. 2 tablets 3 times in a day. Gentle massage the gums with eri medadi oil or jatyadi tail. My dear friends, this was all about the dentistry in general medical practice. So I request all of you to see these wonderful videos by Professor Deshpande. Please don't forget to subscribe the channel and share the video and make your excellent supporting comment, so that I am very happy and encouraged to do such good things. Thank you very much and take care. Bye-bye.